Hi, my name is Leonardo and I'm a family nurse practitioner. How are you?
I'm doing good, thank you.
All right, so I'll be doing your physical examination today.
Perfect.
I'll be explaining to you what I'm doing as I'm doing it. Please feel free to stop me if you have any questions, okay?
Thank you.
So we're gonna start here with inspecting your hair. Make sure there are no infestations, make sure there are no baldness or alopecia, okay? Next thing is your skin. So making sure your skin is nice, pink and warm, which it is. Now let me see your nails. Very good, make sure there is no clubbing or any other lesions on your nails. Making sure your capillary reflex is less than 3 seconds, which yours it is. Very good. Now I'm going to check your scalp. I'm going to be palpating here. Make sure there are no indentations or no masses, which yours is very nice. Very good. Now I'm going to check your sinuses. So I'm going to press on your sinuses. You tell me if you have any pain, okay? Do you feel any pain here?
No.
Do you feel any pain here?
No.
So this is your maxillary sinus, your frontal sinus. They seem to be very good. Next thing I'm gonna check is your temporal arteries, okay? So first I'm gonna palpate them. You let me know if you have any pain, okay? Do you have any pain here?
No.
Okay, very good. I'm gonna auscultate now your temporal arteries to listen for if there is any bruit, which there shouldn't be. You don't have a bruit. Very good. So next thing I'm gonna do is I'm gonna check your and for any jugular vein distension, which your neck veins seem to be very good. Okay. Now the next thing is the trachea. When I touch your trachea, make sure it's midline. Make sure there are no masses. Okay. Now next thing is your thyroid. So your thyroid is right under the hyoid bone. I'm checking for a goiter, which is an enlarged thyroid, and in your case you don't have an enlarged thyroid. Now the next thing is your lymph nodes. So I'm going to start here with the preauricular lymph node, which are right in front of your ears, and you don't have any. Well, they're not enlarged. Any postauricular, they're not enlarged, and you're looking for any of the lymph nodes to make sure they're not enlarged. Okay, make sure they are non-tender, and make sure they're not hard and fixed. Okay.
Okay.
So postauricular are good. Posterior cervical, right here on the base of the skull, are good. Okay, so I'm gonna check in here now your tonsillars. You don't feel any. Any submandibular, any submental, which are under the chin. Now I'm gonna touch here by your sternocleidomastoid. These are your anterior cervical. Very good. Now these ones you gotta press a little harder. Now supraclavicular, right here, and the subclavicular, right here. Okay. So the next thing we're gonna do is we're gonna check your eyes. So close your eyes. I'm gonna press on them. You tell me if you have any pain. Do you have any pain there?
No.
Okay. Now you can open your eyes. Now I'm checking her lacrimal, her conjunctiva, her palpebral conjunctiva. Make sure there is no jaundice, no redness, no discharge from the eyes. Making sure they're moist like the way they should be, and that her lacrimal glands are good, and also her there is no corneal lesion. Okay. So the next thing is I'm gonna shine a light on your eyes, and I'm checking for pupillary response. Okay. So you just look at me. And I'm gonna shine. We're gonna start first with your left eye, and I'm checking for direct and consensual light responses, which means your pupils should accommodate or become smaller as I shine the light in both eyes at the same time. And either or, even if I shine it on the left, they both should do it. And if I shine on the right, they also both should do it. Okay?
Okay.
So they're both equal equal round and reactive to light. Okay. Now the next thing is I could have used the ophthalmoscope, but I already checked it with the otoscope. So do you have any questions so far?
No, not yet.
Okay, very good. So the next thing I'm gonna do is I'm gonna check your ears, and first I'm gonna start by checking by pulling here on your ear, on your peanut, do you have any pain there?
No.
Okay, very good. I'm gonna check your trigger. Do you have any pain here?
No.
Okay, now I'm gonna look at your right ear. And as I do that, I'm gonna pull her ear up with my left hand, hold the otoscope with my right hand, make sure her canal is fine, there's patent. Her eardrums or tympanic membrane, make sure it's not bulging, there is no redness and no discharge. I'm gonna do the same thing in the other side. So I'm gonna pull here with my right hand and hold the otoscope with my left hand. And looking for the same thing, no discharge, no redness, no bulging. Very good. Do you have any questions so far? Are you okay?
I'm okay,
All right,
thank
so
you.
we're almost done, so hang in there. So now the next thing is I'm gonna check your hearing. So I'm gonna whisper something to your ear and you're gonna repeat after me, okay?
Okay.
20.
20.
Very good. I'm gonna do the same thing in the other ear. 20.
20.
Very good. So the next thing we're gonna do is I'm gonna check your nose. Make sure there is no septal deviation. Making sure there is no purulent discharge. We can also do that with the nasal specula. Very good. Make sure there is no excessive redness or no discoloration of the nares. We're gonna check to see if they're patent. So close one nostril and blow out. Do the same thing with the other one. Very good. That's good. Do you have any questions so far?
No, thank you.
Okay, very good. So the last thing we're gonna do is I'm gonna check your mouth. So I'm checking your lips right now. Now open your mouth. And I'm gonna shine a light, make sure checking your teeth. I'm checking under the tongue. Okay, now on top. Now I say ah. I'm checking your tonsils. Make sure that you don't have any enlarged tonsils, any infection there of the tonsils. Making sure your uvula, you don't have an abscess, okay, or anything like that. Well, thank you so much.
Thank you.
That was the physical examination. If you have any questions, let me know, okay?
Thank you.
Have a good day.
You too.
All right.